Good afternoon. I'm Terry Scoggin, Chief Executive Officer of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, April 8th, 2022. Happy April, happy spring. The Easter Bunny is just around the corner. It's gorgeous outside. The wind was blowing through my hair as I walked over here, and I apologize to my fans and friends and family, especially my family who's waiting a few minutes late today because the weather was just too nice outside. I took the long way from the hospital over to the marketing studio, but wanted to come together to start of April and just talk about what's going on in the health center and give you a quick update of some of the things. And this is a big one. This is one that I'm excited just to talk about from a Mount Pleasant, Northeast Texas standpoint of what's going on at Titus Regional Medical Center on the second floor. We've been over 950 to 1,000 births on an annual basis come from this center. People come from 60 miles around in all directions to have their babies here. Dr. Lisi and his family, I think, have 10 babies here, I think is the number he told me at one time. But we have a great OBGYN staff and pediatric staff here at Titus Regional. And the second floor is a maternal service level 2 designation by the state of Texas. We're one of the largest maternal level 2 in the state, one of the few rural hospitals that's a level 2, which means we can keep babies from 32 weeks and above in our area. Well, what it says is we hit the gold standard in the services. And last week, or earlier this week, I apologize, on Monday, we had our surveyors here that from the state and from the federal association that managed this survey. And I want to tell you, our team did an unbelievable job. I want to thank our medical director of Maternal Services, Dr. Chris Mason, our director of our labor and delivery, Michelle Shoemate, and our senior manager, director of accreditations, Cheyenne Harris, for the work that they've done, along with the nurses, the other doctors, all the OBGYNs involved, our midwives involved, our AHPs involved, our pediatricians who work closely with the Maternal Services group. But that survey was unbelievable. And when I sat Tuesday afternoon with the surveyors and we talked through what they found over 2 days here, they didn't find one survey condition or finding to report. And they said it was the first time in the history of them doing over the last 2 years a level 2 survey at a hospital that they found no findings. And it just talks about what Dr. Mason, Cheyenne, and Michelle and the entire team on the second floor are doing to improve healthier tomorrows in our maternal services in Northeast Texas. I brought my notebook today, and I take my notebook everywhere with me, but here are the words that were used during the survey. Commitment to quality and transparency, example for the entire state, unbelievably extraordinary, teamwork, collaboration, offering care, commitment to maternal mortality, quality, collaboration, dedication, an amazing job, a see-feel culture, being with one another. One of the top level 2 maternal services in the state of Texas, and really setting what the state has envisioned when they created this level designation a few years ago. So we sat for that hour and talked to them about things that our team could improve, recommendations, but they went on and on, both doctors, the nurses that were visiting, about the team. And I just wanted to make sure this community knows of the amazing work that's happening on the second floor of Titus Regional Medical Center. It's just a wonderful experience that you're seeing in the labor and delivery area, and just want to congratulate Dr. Mason and the team that was involved in this for all the work's done. So if you get a chance to see any of our OBGYNs that practice in Titus, or the nurses on that floor, or our pediatricians, please give them a shout out, give them a COVID-friendly hug, and just let them know how much you appreciate, because they're doing some unbelievable things. They're setting the standard for maternal health in Texas, and not just rural. Some of the things that they're doing, especially with imagery and some of the quality initiatives that they're taking on, they're leading the state of Texas and being asked to present across the state. So we're excited about that. And I wanted to take a few minutes today just to share that with you, because it was a big deal to me. COVID update didn't go away. COVID's still here. We're going to continue, guys. We've talked about this for 2 years now. We've had our anniversary of our first COVID patient in the last few weeks, and we're averaging between 1 and 2 COVID patients in the hospital. We did have, for the first time this week, a day that we had no COVID patients in the hospital. We immediately had 2 the next day, and then back down to 1. So we're still testing for COVID. We're still giving the vaccine at the Rural Health Clinic, the Family Care Center at Harts Bluff. We're encouraging the vaccine. We're encouraging the booster shots. Wear your mask. Just be considerate as we we go through the spring and summer and we celebrate Easter together next week. An exciting thing, you'll see some press release in the next few weeks. They haven't hit the road yet, but I couldn't hold any longer. Just wanted to show everybody of what's fixing to hit the street. Titus has purchased 2 new ambulances, and we're also, Bobby Moore and the marketing team have worked to come up with our new design and brand. We'll be rolling this out on all of our ambulances. These are 2 new brand new ambulances that will be hitting the street and be legal in the next 10 days. We're excited about this. This is a big win for Titus County and our EMS team. Some of the advancement that these ambulances have with loading and safety, not only to our patients, but our team members who are loading patients, are big wins for this. But it's also from a look standpoint. You're going to see this ambulance coming from down the street, and you're going to know it's Titus Regional. And we're proud to put these on the street. And our EMS team is doing some great things. We'll be having a press release in the next few weeks as we celebrate 911 month and encourage people to call 911 and EMS. But there's some things that they've got going on over there that's unbelievable for this county. One's the Pulsera app, and several of the health systems in Northeast Texas have used this and piloted this. We've been pushing it for a couple years, and we were able to get our systems aligned. But our physicians have really encouraged us in the EMS to implement this Pulsera system. And what it is a communication system. And when somebody has a heart attack or a stroke, EMS is able to communicate with the emergency teams, the surgery teams, the stroke team, the heart attack teams, and all talk in one device and get information. And over the last few weeks, as this device has become live for us, we've seen some of our fastest door-to-balloon times in the cath lab. They hit 16 minutes a few weeks ago. And it's this communication system as part of it because they're able to skip some processes because they're doing it while you're in transport. So it's exciting things. You see Pulsera, and again, I'm going to put it in the press release that Tracy and the team are working on. And the other one that we're excited that we had our health fair a few weeks ago and then at our town hall last week is the Pulsera, the Lucas device that's on the top of the screen there. And this is a CPR device. We noticed during COVID, we had our most code blues, which were called for resuscitations because COVID had hit this community so hard. We did a lot of CPR and a lot of resuscitations in the emergency rooms, in the ambulances. So Jimmy and Suzanne from the emergency department both came to me and put together a pitch where they can improve the safety of this community. It's about a $150,000 investment that we're making in the community for these devices, but each one of our ambulances in the emergency department will have one of these devices to make resuscitation more consistent, more stable, and improve the health of Northeast Texas. We also put out last week, I hope you've seen it, last Friday, was a Facebook post about 911 call. If you haven't gone it, I would encourage you to watch it. It'll take your breath away. This is real. This is not a movie. This is not something that was done from a video perspective just to make up. This was a real 911 call. These were real EMS team members who were called in. At the dispatch that you're going to hear is the real dispatch of a family going through a heart attack at their home and the process they went through. It'll bring chills up your spine. Every time I've seen it, it just makes me appreciate what we're building in Northeast Texas and what this community is doing to support this health system to build it, and the focus on cardiac and cardiology. Dr. Sekulich, Dr. Abbas, and Dr. Siegel, all three are on the video talking about how we work together. But if you get a chance, go to Facebook at Titus Regional Medical Center and check out the video of the Gonzalez family. I think it's well worth your 6 minutes just to spend and talk to them. I want to encourage you to get your bunny ears off the shelf, and I'll have my bunny ears ready for next Wednesday. But we have Lunch and Learn next Wednesday. Lunch and Learn was a hit last month, and we're excited to be back. After 2 years of no Lunch and Learn, our friends were ready to come back and see each other. We spread out a little bit last month, and we'll spread out again a little more this month. But if you have not had a chance to meet Dr. Jane Lee, our new general surgeon, she'll be there next Wednesday. Then also join her is Dr. Beauvais, a general surgeon here at Titus. So they'll be doing the show next week, and they're going to do some body part bingo and some other things going on, having a little bit of fun. But get you a chance to meet Dr. Lee. I think you'll be impressed with her. I know I've been impressed over the last 4 months of getting to know her and her family, and excited to have someone of her caliber practicing in Mount Pleasant, Texas. You'll see over the next few weeks that the fan drive is going on town. You don't need a fan today because that winds over the last few days have been nuts. But this summer it's going to get hot. I'd encourage you, if you have a chance, to drop off a fan. We're going to push at it at the medical center here, trying to encourage that. But we are collecting at the Harts Bluff Family Care Center from fans. If you want to drop them off the hospital too, we'll get them to the right place. But you know what? Go to Lowe's, go to Home Depot, go to Walmart, pick up a fan, go to Mason's down the street, pick a fan up for somebody else, and we'll make sure that it's going up there. And I see my mom's watching, so I'm excited. So thanks, Mom. Good to see you, Mom. Had lunch with her on Wednesday. Had fun from there. Had another great time yesterday. Chapel Hill is doing a Beyond the Box program for their students. And it was fun to have 5 students come visit us yesterday. It was actually 6 students that came and visit. And we were able to talk them through the healthcare industry. Everybody knows about doctors and nurses, but there's so many things that happens between those walls behind me. So it was exciting for them to talk, to see what's going on, talk about professions that they could get into, but also talk about reasons why they should stay in Mount Pleasant, why they should go and just do things to help the community here. So appreciate Chapel Hill and the work that they're doing, and we were able to get those students here, and we look forward to things going over the next few years that program develops as well. I also want to give a shout out to Coach Cooley at Mount Pleasant High School, the football coach who just joined us. I've seen he's had a few new coaches coming to town, but I had an opportunity to meet him a couple weeks ago. We've started football physicals at Dangerfield today and got that going on. Mount Pleasant will have their physicals as we really start getting ready for the summer and football season just around the corner. We're excited today that I had a meeting with Coach and the Booster Club. We're going to do some things with them next year, so we're excited about things to come. But I wanted to welcome Coach Cooley and his family to town and look forward to working with him and supporting the Mount Pleasant Tigers over the next few years as well. Had an opportunity last week as well to go to Austin and meet the Texas Workforce Commissioner. We had a workforce and partnered with the Northeast Texas Workforce Solutions Board. Dr. Rose with NTCC, myself, and a member of the board went to Austin. All the workforce commissions across the state of Texas came together last week, about 84 people in the room, with the purpose of trying to look at the issues that are going on, workforce labor issues in healthcare. We have a shortage of nurses, and COVID did not help. And we've got even bigger issues since COVID. So we had all the regions in Texas come together for just a day of brainstorming. We'll get together the first week in June. I had an opportunity to meet the commissioner last week, talk to him, explain the challenges that you have in a rural health system in rural Northeast Texas, but we look forward to working with him and the things that are going to come from there. I want to just say thank you to this community as we celebrate Easter next Sunday. We'll have an opportunity to come on before then. So just wanted to wish your family as we come together and we celebrate this season and we celebrate the crucifixion and the resurrection of our Lord Savior. Just want to thank you for everything done, the prayers that you've given this health system, the prayers that you've given me and my family and my team here over the last 2 years, that just enjoy Easter together, spend time with your family. God bless, and we truly love you guys. Thank you.